We're from Physical Therapy in Motion, right here in Centerville in the Bell Tower Mall. My name is Eileen Cullen. I've been a therapist on the Cape for 28 years now. I started out in Yarmouth and opened up a clinic in Centerville in 1997. So I've been in Centerville since then. We opened up Physical Therapy in Motion in 2008, and I've been fortunate enough to have Terry working with me since 2001, so for a long time now. And you can introduce yourself.
So I'm Downey. I live in Centerville, and I work in Centerville. I grew up in Osterville.
I live in Barnstable, sorry.
I started out as a physical therapy assistant in 2001, and then went back to school for my doctorate, which I finished in 2012, and still came back to Centerville. And yeah, I know a few faces in here.
But can we get a little slide on the next slide? Yeah.
Good.
Okay, you did. That's not changing, that's.
Yeah.
We'll just, again, stay close. So Terry and I are going to tag team. I'll start and then Terry will take over in just a little bit. We're going to go to this third slide. We're on. Okay, so if you're thinking about posture and you have somebody walk toward you and they have good posture, what are the impressions that you have? You have the impression that the person has confidence. They look youthful. They look strong. Somebody always looks stronger who carries themselves better. The other benefits, obviously, you have improved bone health. The reason being that the bones are stacked and that you have the right forces and so forth. You'll have decreased stress on the spine and the disc, as you'll see in a moment in some of the slides. It encourages stronger muscle through muscle balance. If you have poor posture, you're going to have shortening on one side, lengthening on the other side, so you'll have weakening and you'll have ineffective muscles. You're going to have fewer complaints of neck and back pain and improved lung function because your rib cage is opened up and you're feeling broader. You can breathe better. You can exercise with Julie better. I'm going to go to the next slide. The spine, it's important to know that the spine has multiple curves. In a sense, it's kind of like a bridge in that you have to have the loads being transferred and you have distributing stress effectively. So you have the cervical spine is the neck, thoracic spine, the lumbar spine, and then you have the sacrum and the coccyx, which is fused down below. So it still surprises me sometimes when you have a patient who thinks the spine is one big bone. It's not one big bone, it's many bones, and you have to have that compression going through it. Sometimes people have a flat back and they have less movement occurring in their spine, and that's going to be a little bit more harmful with different loads being imparted. But poor posture is what we're talking about. So if we go to, or we're talking about posture. Thank you. There you go. Now this person is not exuding self-confidence. This person is going to be more prone to having neck ache and backache as well as headaches. You're going to have shoulder pain and dysfunction because what happens is when you have poor posture and your scapula are moved back, they may also be moved forward, and when you go to raise your arms, you're decreasing the space where the rotator cuff tendons are. There's a bursa in there. So you're already making what's called a subacromial space in between the top of the shoulder right here and the head of the humerus. You have a subacromial space, so the rotator cuff tendons are going to be irritated because you have that poor posture. Your arms are hanging down, you're a little bit internally rotated, so it's not good for your shoulders. You have an increased thoracic kyphosis, that's the thoracic spine, remember? It's normal to have what's called a kyphosis. You don't want to have an excessive kyphosis because, again, that's not going to help with lung function. And you have the scapula being abducted, moved out, and you're going to have less effective muscles. So you're not going to have that muscle balance we talked about. You're going to have an increased risk of compression fractures because of the load of the segments. You're going to have uneven pressure, more pressure in certain areas. If you don't have optimal bone density, you're going to be more prone to having fractures. We have a slide coming up that we'll see, I believe it's on Terry's side, and you'll see what the bone looks like when you don't have optimal density in your bone, which happens with age and with lack of exercise, poor diet, hormonal imbalance, and so forth. You'll have an increased stress to the intervertebral discs and a risk of herniation. if you always have, you'll see with some of the sitting postures, that if you have poor posture and you have pressure with the bones going in such a fashion, the disc has more pressure being moved out posteriorly, right where the nerve roots come out. You've heard of somebody having a herniated disc and then having sciatic symptoms, like that. Oftentimes that can be from poor posture as well as obviously from trauma or what have you. Increased forces causing progression of degeneration and leading to arthritis. If you go to the next slide. Yeah, this one I was afraid it was going to come out like this, but you can see a little bit the person's poor posture, how they're like that. Again, we talked about having the scapula adducted, the increased kyphosis. This person on the left has a flat back. The balanced upright posture, you can see how everything's in alignment. You have the correct stacking of the bones, everything's in the right place, the right muscle balance. And again, if you have the correct muscle balance, you're more efficient. You can function better, you can play better, all those kind of things. The poor posture in the front, it's the forward head that oftentimes is very much a problem, because when people have this forward head kind of position, they're going to have some lengthening of some structures, shortening of the other structures. That's hyperextension actually in your neck, because if I just stood up, that's really this. I didn't change my neck. I just changed from my mid-back. And then that's causing the hyperextension in your neck, which is closing the space where the cervical nerve roots come out, then causing possible symptoms down your arm, arthritis in your neck. People don't realize how much a forward head affects or leads to arthritis and affects how you feel in terms of headaches, in terms of neck pain, shoulder pain, numbness and tingling down the arm, and so forth. Oftentimes it's a matter of the sitting posture as well. I think is the next slide the... No, I'm sorry, here, so we're talking about the hyperextension in the neck. This slide you can see a little bit better about the kyphosis that I was talking about in the thoracic area. You're going to have an increased lordosis or curvature in the lumbar spine. That's going to create the pelvis being tilted forward a little bit. And the knees oftentimes hyperextend. You can see it says the legs are behind the plumb line. So what happens if everything's off a little bit, you develop aches and pains over time. And then trying to improve that is hard because you haven't recognized what you've been doing wrong. The next slide. Text neck. This is probably becoming quite the problem, as thing goes. So looking down at your cell phone all the time is going to be placing the stress. It's been shown that if you have your neck this far forward and you're looking down all the time, that's about 60 pounds of pressure. Now if you think your head weighs about 11 pounds, and you think of gravity coming straight down, if I have good posture, that's 11 pounds coming straight down. But the more I go like this, the more gravity is pushing down like this, the more pressure. So this says that 60 pounds of cervical, of pressure on the cervical spine at this point. With the head neutral, it's only 10 to 12 pounds. And they're saying the text neck is similar to carrying an 8-year-old child around your neck for hours. And people don't realize that because you're just simply looking down and moving on. The next picture, I believe, shows, so 60 pounds sounds like, if you look at that picture of the last slide and you think, I don't really look like that. All right, or maybe I look like that. You know what I mean? And that one's 40 pounds or 27 pounds. They're all way heavier than the 10 to 12 pounds on your neck when you're upright. You could simply hold your tablet or hold your phone like this and do what you need to do and just have good posture as you're doing it, as opposed to all the forces going through. So what I talked about with the effect on the muscles, poor posture is going to cause tightening on one side and you're going to have stretching or inhibition on the other side. So if the person if they're coming forward like this, you're going to see that they're going to have a tightening of certain muscles in the neck on one side, lengthening on the other side, and then they get weak. Then you have the opposite. This just shows a cross syndrome. In the upper back, where I talked about having the scapula being what's called abducted, just moved out farther away from the midline of your back, with that constant stretching, you're going to have some inhibition of the muscles, so the muscles get weaker. That's why it's important to do proper exercise in order to strengthen that, doing rows, doing scapular retraction, that kind of thing in order to build those muscles and try to stand up good and tall. I think the next slide shows, all right. So this shows how you're going to have shortening. If you look at the length of this particular muscle, how it's longer there and shorter here. You know what I mean? And then longer there, you know what I mean? It's showing how you're going to have inhibition of these muscles and you're going to have a tightening in the back. And when it's tightened, you're just accommodating to that forward head position. Your head gets used to it. You know? So this is going to show again the cross syndrome. The person standing this way, they have their pelvis anteriorly tilted. You're going to have weak abdominal muscles. You're going to have tight hip flexors, because here I showed how the hip flexors actually go from the transverse process of the lumbar spine to the top of the femur. That's going to end up shortening. So then you have to make sure that you stretch the hip flexors because they become tight, and that can lead to back pain and degenerative changes. You're going to end up having weak hamstrings and weak glutes. It's amazing to me how many times we test hamstring strength and how weak that becomes on people over time, and oftentimes it's because of posture. Yeah, for the next one. Poor habits start young. You know, you see the way some of these, not only kids, you know, some of ourselves, or maybe our spouses, are sitting poor. But what's most important is how then you're sitting at a desk. If you show the next one, how many times do people sit over here to the left and not be completely upright in terms of approaching their work? It's interesting to me how many times people ask me about, well, I have a good chair. Okay, well, let's talk about your chair. And then it turns out they're not really even using the chair. They're only using the front of the chair. They're not sitting against the lumbar support. The chair's not pushed into where they're sitting. They're sitting on the edge and looking forward. But I have a good chair. But you're not using the chair. So the chair is important, and I think the next slide, this is where Terry's going to take over and talk about the things that we can do about posture. But it comes down to, if you see this, the major thing to see is the muscle imbalance. It causes a tightening on one side and a weakening on the other side.
So one of my favorite things to do when somebody's in the office that's got really, really bad posture, and they don't believe me, is when they're in the waiting room reading a magazine. I'll sneak between the plants and snap a picture on my cell phone and then show it to them. Because they're like, that is not me. I'm like, it's right there. So workstations. Feet flat on the floor. People like me have short legs. Most chairs, my feet don't hit the floor. So I sit forward, so you can put a book under your feet, something, but you want your feet flat. When your legs don't hit the floor, you're putting more strain on the back of your legs, you're putting more strain on your back. You want your knees, your hips 90 degrees, right? So you don't want your knees way up, but you also don't want them not at 90. In your hips, you want to snug all the way back, have a nice lumbar support in your chair, so you're up nice and tall. You want your elbows to be able to rest, but you still want, if you think 90 degrees at all your angles, that's your comfort zone. One of the things they don't talk about a whole lot, if you Google workstation, what they don't talk about is glasses. They actually make computer glasses now, because progressive glasses like these, you have to do this. And where's my neck? So if I do this for a couple hours, my neck's not happy. So that's one thing that they don't talk a whole lot about, but it can be really important. So again, just what I just said. So the 90-90s, pretty much if you think all 90-90s, don't be tilted up, don't be tilted too down at your computer station. Don't have one thing over here and your screen over there. So that's important too. Also now, like in our office, we have standing desks. And they make some that you can stand up, sit down, so you can change during the day, which is nice to not have one specific posture. So what can you do? Pay attention to where you sit. Pay attention to what you do. Often recommend set a timer. Every half hour, just move for a minute, Pull your shoulders back, make sure your posture's good, get up, walk around the room, go back and sit down. It doesn't take just a minute, and it makes a huge difference in how you feel. And then making sure you keep stretched, make sure you keep strong. You know, we tighten up pretty quick when you get intense on work. You think about some project and you get deeper and deeper and deeper into it. Make sure you get out of that posture. Pull your shoulders back. Make sure your head's up over your shoulders, not up here. Yeah, it'll make a huge difference. Let's take a break. So I talked about the first two. One of the things we like to tell people when you're driving your car, sit up, get your posture nice and good, fix your rear view mirror so it's perfect out the back window. And then as you're driving, every once in a while look up. Is it still in the rear view window or has it sagged? Don't fix the mirror, fix yourself. That's one of your cues. And start watching, you know, we get people in our office telling on each other all the time. They're like, they're not doing that. So look at other people. You know, look at that person that's like this, and you'll start pulling yourself up, because that's like, and you're walking by a glass and you get your reflection to see, you know, where's my posture? Am I all stooped over, or am I up nice and straight? And then support your spine. So, it's really important to have motion in your spine, and a lot of people don't want to spend 5 minutes a day to make sure they have good mobility. And it's not that difficult. They're so very easy, just mobility exercises to keep everything moving. And this is where it's move it or lose it. That's 100%. What we do know is our spine peaks in our early 20s, and then it starts to degenerate. You know, which wasn't a big deal when we died at 50 years old. It's a big deal when we're living to 80s and 90s. So your spine needs to move. And when you hurt, not moving makes it worse. So moving is important. Stretching super important. Like Eileen was talking, we do a lot of sitting, either at our work or we retire and we're lazy. I didn't mean that. How I said it. We retire. Some people like to sit around, and they get really tight hip flexors. Greatly affects our back. But that not only affects our back, it affects our upper back, and then it will affect our neck, because nothing in the chain works anymore. And then weight-bearing exercises, super important. We lose bone density as we get older. Weight-bearing exercises help us build bone. Impact builds bone. Sitting, a lot of sitting makes bone more porous. So we'll lose more bone mass that way. And then strengthening the core. So our core, we have the core for our lower back, but we also have the core for our neck, which most people don't think about. So we know, tighten up if you're going to lift something heavy, right? So what that does, you tighten up the muscles here and say, here's our spine. If we don't engage our core, we get a lot of shearing, like this. Our spine isn't stable. And when we do a lot of this, we get a lot of bony buildup. So we get more degeneration. Our discs break down more easily. They rupture more easily. Same thing happens in the neck. We've got these little tiny stabilizers in the neck that are very subtle. And we have to learn how to engage those. Again, if we don't engage them, we get more of this. More breakdown of the disc, more buildup of bony buildup. And then you've got that arthritic spine that doesn't move. Not fun. There was actually a good story on the news last night. They did a study on physical therapy versus yoga versus, I think it was injections for spines. And what they didn't say, they showed a piece of the yoga. It wasn't traditional yoga. It was a very fact-specific yoga that I had never seen before. But basically, they were showing that specific spine yoga and physical therapy had similar outcomes where the traditional medical didn't have as good an outcome. And so, this is a plank. And it's really interesting because the man at the top, a lot of people, you'll say, can you do a plank? Sure. And that's what they look like. and they cannot feel that they're not in the right position. Cannot feel it. And there's a word we use a lot, it's called proprioception. So our proprioceptors tell our body where it is in space and time. When your posture's been bad for so long, you no longer know what it is. So that's part of the retraining is, you get them into this, and then you try to get them to feel it, and then be able to replicate it. And then build the endurance to stay that way. That can take some time. That's, but super important. And then osteoporosis we talked about a little bit earlier. Over 50 or so, we start losing bone mass. Actually, it's over 30. Our bone mass peaks at 30, and then it slowly starts. We don't build as much bone as we lose. Female over 50, fair, are higher risk, but men are also at risk. Living in New England, we don't have as much sunlight. The incident has increased since people are better about sunscreen. So that's good, but we are not absorbing as much vitamin D. So it hurts us on the other end. So there's going to be a balance in there. Osteoporosis causes compression fractures. People like to, they don't stay strong. And people sit in chairs like this. And then those legs get weaker and weaker, and then they can't sit down. And we've had patients after fractures like that. I had a patient with a burst fracture after being at the dentist for an hour. She goes, I was really nervous. And she had a huge burst fracture just from being tense, sitting in the dentist chair. So that's very important. Medication. That's a hot topic right now for osteoporosis. The old line of like Fosamax and those drugs, they're not really seeing the benefit versus the risk anymore. Depends on the person. They've had other fractures from the drug itself. They have some new infusions they're working with now, but they're not treating it. They're going more healthy diet, weight bearing, weightlifting to build more bone, and trying to do that instead of the drugs now. Because new ones are out there, promising, but so are the other ones years ago.
Please notice the picture of that osteoporotic bone. You can see why it's so easy for somebody to fracture. As Terry was saying, if they just plop into a chair, if your bones are that brittle, that's how you break. But I had a woman sneeze one time. She fractured a bone.
And there's your vitamin D. So, vitamin D, again, we get it a lot from the sun. But we live in New England, as you know, we haven't seen the sun in 6 months, except the past 2 weeks. And then, people use sunscreen now, so when the sun does come out, we're not getting our vitamin D. So for us, especially in this area, supplements are important, and good foods. I'm not really good at naming off a bunch of foods that have vitamin D, but I think spinach is iron and calcium.
It's the like mackerel, salmon, tuna.
Yeah.
There's not enough
It's not
foods
a lot.
that people are like, I'm good dietary wise. You really need supplements for vitamin D.
Yeah.
Or a lot of sun.
Or a lot of sun, right? Or both.
Or both. And then eat healthy. So protein's super important for bone, for healthy muscle growth, and calcium and iron is important. Iron's important for our blood, which for bones. Calcium's important. We need vitamin D to absorb calcium. We need calcium to help build bone. So those all work together. And again, healthy eating is going to keep you healthier. You're going to get less colds. You're going to get less flus. you know, have overall better health. You want to have sticky teeth. Keep down, you know, I have somebody, patient with back pain and a very large belly. And you have a poor diet, you have a big belly, well, that's just gonna crank on your back. And I can do all the PT I want on that back, but if we don't lose that huge belly, then we're not gonna solve that problem. So, healthy eating is very important there too. So, in a nutshell, pay attention to your posture. See how you look. See, you know, another place to look at your chairs in your living room. You know, do you have a big soft couch that you're sinking and you're rounding your back. That's gonna put you at higher risk for disc issues. It's hard to get up out of as we get older. You know, what does your desk, what's your workstation look like? You know, you cranked in one position or another. We have a high grandparent population. Are you down talking to your grandkids a lot? Look at my neck, right? We don't realize when we're down talking to the kids like this, that we're just cranking on the neck, and our necks don't like that after a certain age, because we have degeneration. So those are posture things you don't think about, but become important. You know, daily exercise, super important. Julie already went over that 3 to 5 times a week, was that your? Yep. Which I totally agree with. Eating right, and you know, as you get aches and pains, you know, some are normal, but like, I'm stiff, I'm sore, okay, but pain, like real pain, that's not normal. Something's wrong, your body's telling you something's wrong. And don't wait until you have a